Okay, so this is the first in this series of podcasts of how to set up the teeth. So first of all, we can see here we've got the registration rims. I've taken the incisal guidance pin out just so you can see more clearly. I'm a little bit concerned when I look at this because I can see the lower rim sticking out unilaterally more than the upper rim, so I'm a bit concerned that it's a crossbite. However, when you take it off, you can see that the upper rim's actually over the lower ridge on both sides, and it looks like there's a bit of overextension on that patient's right hand side.
Yeah, somebody's been a bit over enthusiastic with the impression, haven't they?
Yeah. So first of all then, we start by setting the upper anterior teeth. You'll see that we've got the incisal guidance pin back in place now.
How did you pick these teeth?
Well, these are normally picked clinically,
Mm-hmm.
although in this case we had the patient's old denture which they wanted matching, so we can measure the patient's old teeth. Quite a simple process. We measure canine to canine for the overall length of the 6 anterior teeth, and then we can measure the central incisor as well and get a width for the central incisor, and then look for the mould that's the correct shape, and then it's a simple matter of just selecting the correct shade. So that's relatively easy.
Yeah, so I notice here you're using the method where you're going to put the teeth into the registration rim.
That's right. I've just cut the a portion of the rim out, just big enough to take the upper right central incisor. The other thing that I did, we've just gone past it a bit, I picked the tooth off the card, and it has a little bit of horrible carding wax, which is a soft,
bright red, isn't it, usually?
Yeah, a soft wax which is very sticky. But it's a real pain later on when you're trying to carve this. That was me burning my hand. It's a real pain later when you're trying to carve the wax, so you must always wipe that off with a piece of tissue to start with. So we've placed the tooth there into the rim, and we've got it following the labial contour of the waxwork, which has been determined clinically. And now we're just adjusting this tooth, and we're going here for the classic sort of NHS style gnashes, if you like.
NHS smile, yeah.
An NHS smile. So we're getting this central incisor straight up and down, a long axis of the teeth, straight up and down when you look at it from the front. A slight incline, slightly proclined for the when you look from the side, so the incisal edges out a little bit more.
Now you're quite lucky here that it went straight on.
Yeah.
Because you've used a resin base for your registration rim, have you?
That's right.
Yeah. So sometimes they're quite thick, and the neck of the tooth is it needs to be trimmed often, doesn't it?
More often than not, actually, you find, particularly when you use these resin bases, because they're a little bit thicker than the alternatives, and the alternatives. Yeah, I don't know, what did you use to
1.5 layers of wax and a wire strengthener.
Yep, you can do that. The disadvantage with the wax base is that when they're in the mouth, they can, if they're in there for any period of time, they can distort very slightly. So for student use, we tend to use these hard acrylic, well, light cured acrylic bases.
Yeah, they are very good for the try-in stage because you can use them and abuse them.
The only problem is if you need to do lots of adjustment, the wax ones would have been easier to adjust. Alternatively, there's a compromise. You can use a shellac base, and a lot of laboratories use those, and it's a hard material that softens in the Bunsen.
So you're just putting your other essential on, paying careful attention to the midline here, aren't you?
Yeah.
Because it's easy to, because this is your anchor basically, isn't it?
That's right, yeah. The centre line was one of the 5 pieces of information that's been recorded using the rims. So we're starting off from that centre line. The other pieces of information being the lip support, so that's giving us the labial surface of the anterior teeth. And of course we've recorded the occlusal plane, so that gives us where the incisal edges should be placed. So we're following the instructions from the rim all the time.
See, and the way I learned, just as a contrast, and wasn't such a high risk strategy as this, is we always kept the registration rims. Yeah. So it would involve using a metal table in place of the lower registration rim that was mounted onto the articulator in place of the lower model, and drawing with a pencil line around the registration rim and marking everything, and then putting the teeth onto a new base. But this method does, it's a bit quicker and a bit more accurate, really,
it saves making a new base. Yeah. Sometimes you see that some technicians will build the lower rim out with some more wax to match the upper rim, and then create a new base again for the upper and set the teeth up to match. And we used to do that at college as well sometimes.
Okay, what have you been planning? You put a lateral and a canine on while we've been talking. So how
Yeah.
have you lined those?
The lateral tends to be a millimetre or so off the occlusal plane, and when you look at it from the front, it's rotated through
That's a good view of it there, isn't it?
five
Yeah.
degrees or so. So it's the long axis of the tooth is just off sort of to 11 o'clock. And when we get round to the canine, that's bolt upright in both planes. So it's sort of the cornerstone of the mouth, really, straight up, straight down, and you can see that there.
Later on, we'll probably talk about a few tricks with the canine, because
Yeah,
you can inadvertently change the look of the denture quite quickly by rotating the canines.
Yeah, we often can record clinically, or the dentist can record clinically where the canine should be, and we do that in relation to the smile lines and the corner of the mouth to ask where the canines want to be positioned. Okay, very quickly then, copied on the other side. You'll see this in more closer up in the next podcast. That's the 6 anterior teeth complete. Okay, job done.
Excellent.